Effects of dehydration. Dehydration is the absence of a sufficient amount of water in your body. The best way to beat dehydration is to drink before you get thirsty. If you're thirsty, you're already mildly dehydrated, and that can cause symptoms like headache, fatigue, dizziness, and more. Dehydration can contribute to life-threatening illnesses like heat stroke. What is dehydration? Warm weather brings with it thoughts of cool ocean breezes, napping in a hammock and sipping a tall glass of lemonade. Now hold on to the mental image of that lemonade, because summer is also a time to be wary of dehydration. The lack of sufficient water in your body, specifically in your cells and blood vessels. Even losing a little bit, as little as 1.5% of your body's water, can cause symptoms. Those symptoms can be as simple as a slight headache, or the dehydration could contribute to a life-threatening illness like heat stroke, hyperthermia. Your body's natural response to inadequate hydration is thirst. You should respond to thirst right away by drinking fluids, preferably water. Drink enough water to prevent yourself from feeling thirsty. Water has 0 calories. What does water do for your body? Between about 55% to about 78% of your body is made of water. Newborn babies are about 78% water. A year-old baby is 65%. Adult men are about 60% and adult women are about 55%. Your brain is made up of 73% water, and so is your heart. Your bones are 31% water, muscles and kidneys are 79%, and your skin is 64%. A whopping 83% of water makes up your lungs. Act as a shock absorber for your brain, your spinal cord, and, if you're pregnant, your fetus. Water is important to your body, especially in warm weather. It keeps your body from overheating. When you exercise, your muscles generate heat. To keep from burning up, your body needs to get rid of that heat. The main way the body discards heat in warm weather is through sweat. As sweat evaporates, it cools the tissues beneath. Lots of sweating reduces the body's water level, and this loss of fluid affects normal bodily functions. Drink water. Are hypovolemia and dehydration the same? No, these terms do not mean the same thing. Hypovolemia defines many conditions where extracellular fluid volume is reduced. Dehydration can be one of several causes of hypovolemia, but it is not the same thing as it. Are dehydration and hypernatremia the same? Again, dehydration can be a cause of hypernatremia, but it is not the same thing. What causes dehydration? Dehydration happens when you don't drink enough water, or when you lose water quickly through, for example, sweating, vomiting, and/or diarrhea. Certain medications such as diuretics, water pills, can result in increased urination and dehydration. Who's at risk of becoming dehydrated? Anyone can become dehydrated if they don't take care of themselves and drink water. However, infants and children, especially when they're sick, are at a higher risk because they may be unable to communicate that they're thirsty. Monitor the amount of fluids your kids take in. Older adults are also at a higher risk. Their body's fluid reserves shrink and their body's ability to tell them they're thirsty doesn't work as effectively. This means they don't carry as much water in their bodies and they can't tell as easily when they're thirsty. If you're a caretaker of an elderly individual, especially one who may have memory problems, offer them drinks frequently. Even if they're enduring an uncomfortable infection like a UTI, urinary tract infection, they still need to consume liquids. What are the signs of dehydration? What does dehydration feel like? If you suspect that you or someone else is severely dehydrated, seek immediate medical attention. In what other ways does dehydration affect me? Dehydration does more than you might expect. It affects you not only physically, note the signs stated above, but mentally and emotionally as well. If you're dehydrated, you may feel. How does dehydration affect the brain? Severe hydration shrinks the blood vessels in the brain. When there aren't high enough fluid levels in your brain, that affects your memory and coordination. How does dehydration affect the heart? Can dehydration cause high blood pressure? Your heart has to work harder when there's less water in your blood. How does dehydration affect the kidneys? The average person urinates, pees, about 6 or 7 times a day. If you're dehydrated, you may urinate less. This is because less water in your blood causes your kidneys to hold on to the urine. Does dehydration cause cramping? Loss of electrolytes, like sodium and potassium, can cause cramping. They're expelled through perspiration, sweating. Drink water, but also a sports drink to replenish your electrolytes if your fluid losses are extensive from sweating, vomiting, or diarrhea. Can medications cause dehydration? Diuretic medications, which are prescribed to treat heart failure and high blood pressure, can increase your risk of dehydration. Can dehydration cause shortness of breath? Shortness of breath is not a symptom of dehydration. However, it may go alongside dehydration. For example, you might be playing a sport outside in the hot sun and get dehydrated from lack of water and also feel short of breath from all the activity. How do I prevent dehydration? Exactly how much water do you need? That depends on your weight, age, level of activity, the climate of your environment and other factors. Those with diabetes, heart disease, cystic fibrosis and other conditions may need to be cautious. The amount of water you need can also depend on the climate and what clothes you're wearing. Although the standard advice is 8 glasses of water per day, about 2.2 liters or 2.3 quarts per day for an adult female and about 3 liters or 3.2 quarts per day for an adult male. Talk to your healthcare provider to confirm the right amount for you. Keep track of how much fluid you drink. Drink water throughout the day, including at meals. Avoid soda, alcohol and caffeinated drinks. One way to make sure you are properly hydrated is to check your urine. If it's clear, pale or straw-colored, it's okay. If it's darker than that, keep drinking. To avoid dehydration, active people playing a sport or exercising, should drink at least 16 to 20 ounces of fluids 1 to 2 hours before an outdoor activity. After that, you should consume 6 to 12 ounces of fluid every 10 to 15 minutes when you're outside. When you are finished with the activity, you should drink more. How much more? To replace what you have lost, at least another 16 to 24 ounces. Which beverages hydrate the body, and which dehydrate? Some beverages are better than others at preventing dehydration. Water is all you need if you're planning to be active in a low or moderate intensity activity, such as walking for only an hour or less. If you plan to exercise longer than that, or if you anticipate being out in the sun for more than a few hours, you may want to hydrate with some kind of sports drink. These replace not only fluid, but also electrolytes like sodium and potassium, which are lost through sweating. Too much or too little sodium and potassium in the body can cause trouble. Muscle cramping may be due to a deficiency of electrolytes. Beverages containing alcohol or caffeine aren't recommended for optimal hydration. These fluids tend to pull water from the body and promote dehydration. Fruit juice and fruit drinks may have too many carbohydrates, too little sodium, and they may upset your stomach. The amount of water needed on a daily basis depends on many factors, so it's best to check in with your healthcare provider to determine exactly how much will keep you healthy. Always drink water immediately if you feel thirsty. Remember, if you feel thirsty, you're already dehydrated. You may see the symptoms of dehydration improve in as little as 5 to 10 minutes. If you think your symptoms of dehydration are severe, don't hesitate to seek help. Dehydration can contribute to kidney stones, kidney failure and heat stroke, all life-threatening illnesses. Call 911 or go to the emergency room right away if you have symptoms of severe dehydration. Like, comment, share and subscribe to my channel.